important things that they can do for themselves is do not smoke, exercise regularly, keep their weight within a healthy limit.
Great. Dr. Rehan, thank you so much. I'm going to have Christina walk me through and show me coming through the north lobby, but we appreciate your time and your insight and to help us learn more about the healthy heart. Thanks so much.
Thank you.
Okay, so I'm going to go ahead and have you walk me through and kind of talk to me a little bit about our north waiting area and the north lobby and what patients will see when they come through that can possibly help them not be as intimidated to come into the hospital setting.
Well, when they initially come in, they'll register, and registration is either the registration in the south entrance, that's where you come in the main entrance of the hospital, there's registration there. There's also registration in the north area where the emergency room is. And then they will send you down here to the north waiting area. This is our waiting area in here.
Very nice.
And this is where you will be when you wait your turn for your stress test or your EKG or your echo or whatever it is you're scheduled for that day.
Perfect. And then we'll go on out towards where actually many people will come through in the north lobby, which is the now where everybody enters for outpatient surgery. Is that correct, many of them? Or is it just this type of testing?
Just this testing.
Okay.
Typically we have our surgery patients come through the south entrance because that's where our surgery area is located.
Okay, perfect. We're going to be walking by the pharmacy so we can get a nice shot of that. It's very nice for patients and specifically patients' families to not have to leave to go to another location post-surgery to pick up prescriptions.
Yes, that is just one of the things the Fairfield Medical Center has done, listen to our patients and how they are looking for some convenience, and this makes it very convenient and patient-friendly that they have an access to pharmaceuticals before they go home.
And it's nice. It's just outside of, and I'm sure Bob's going to show us with the camera, those folks who are leaving the emergency room area.
Yes. We've had recently redone the emergency room, and it's an absolutely beautiful area to come into, and they'll get you through and triaged.
Well, I appreciate the tour downstairs. We're going to now take a quick break, and we're going to move upstairs so that we can see if somebody has gone through perhaps open heart surgery, whatever the diagnosis may have been and the procedure they've had, where they would head next post-surgery to go ahead and start their rehabilitation. So thank you very, very much for the tour and for all of the information. And we're going to take a quick break and be back with Fairfield Today.
In our daily lives, we make many decisions. Life is made up of choices that may seem insignificant at the time, but add up and affect our lives in the biggest ways. Like the health of your heart disease is the #1 killer of women. Making the right choices can reduce your risk. Choose to see your doctor. Choose fresh, not fried. Choose to walk. Choose to live. Make the choice to beat heart disease at GoRedForWomen.org.
Welcome back to Fairfield Today. I'm Susan Nixon-Stoughton at Fairfield Medical Center with Christina Seymour-Harley, the cardiovascular nurse navigator, who has just moved us from the diagnostic area. We're now heading upstairs to rehab. Talk to me a little bit about what we're going to see.
The rehab area is where patients come in for an 8 to 12 week program after certain diagnoses such as MI, stable angina, open heart surgery, or valve surgery. And it is a program to help recondition your heart and also helps with some of your risk factors for coronary artery disease. One of the people who's really involved with the cardiac rehab department and cardiac education is one of my coworkers, Noelle Pierce.
Welcome, Noelle. How are you? Nice to meet you. We are now going to transition into a patient who possibly has gone through a type of a heart procedure and now has been received orders to come through some cardiac rehab.
Yes.
So talk to me a little bit about the process, how you get people started, and we'll take a quick tour of the room.
Okay. Cardiac rehab, you have to have an order, of course.
And by an order, it's a doctor's order?
Physician's order,
okay.
Yes. And you have to have had open heart surgery, a heart attack, PTCA stent or coronary stent, angina, things of that nature.
Okay.
And like Christina was saying, it is an 8 to 12 week long program.
Okay.
And this is our cardiac rehab facility here. And as you can see, we have some patients here exercising currently. These are patients who have actually completed the program, and they are doing what is called phase 4 cardiac rehab, which is where they come in on their own and continue to exercise and do their cardiac rehab. And joining us today, we have Dr. Bardalis, who is one of our cardiologists here at Fairfield Medical Center, and he is also our director of medical director for cardiac rehab, and his nurse practitioner, Dee Flowers.
Talk to me a little bit about the first steps, how somebody gets started into rehab post-surgery.
After our surgery, we have a period of recovery initially, and once they are able, we are trying to keep them away from the surgeons anymore. The cardiac rehab is a great way of reducing, basically, when we talk statistics, morbidity, mortality, 25% reduction over the first couple of years by getting into the rehab program. Encouraging heart-healthy activities, tobacco cessation, all the kind of things that we really should be doing in our life, but many of us, we know what the right things are, we just need the encouragement to actually do it. So the community needs to be encouraged, and in Fairfield Medical Center, we have the program set up, and Noelle is part of that. She'll get down there, and when the patients are ready for getting ready for discharge, we start the process right then and there to help get folks enrolled.
So they haven't even left the hospital yet to go home to start to rehabilitate, and we're working with them on a schedule of getting them back into the hospital.
That's our goal. Occasionally, weekends, busy, we may end up having to call them, but the real benefit is up front, get the patient educated as soon as possible.
So when somebody comes in for their first visit, is it mainly a lot of testing that goes on, or are you pretty anxious to actually get them on a piece of equipment, even if it's just for a few minutes?
There's some of both of that.
Okay, just really depends.
Yes.
Okay, Dee, talk to me a little bit about how long you've been with the hospital and how you work with Dr. Bardalis and making sure that people are successful with their recovery.
I've worked pretty much my entire adult life at the hospital. I started out as a 19-year-old nursing assistant, so it's been a long time. It's a good program. I've watched the cardiac rehab program progress through just a tiny little place with a few pieces of equipment to this beautiful facility that you see now. It's an excellent program. The people who direct it, Noelle, Teresa, all of them that work with the patients are dedicated to helping people do better with their lifestyle choices and regain their health. It is the step that they need to take to make the changes.
And I should point out that Dee is a nurse practitioner, and works alongside with you with the patient. So it's wonderful to know that there's the team approach to really make sure that should I end up in here, that you guys are setting me up for success. It's a good feeling. Talk to me a little bit about some of the steps that you take the first time you see a patient coming through the door and they've got their tennis shoes on, they're just ready to go.
Well, actually, my first step is actually while they're still here in the hospital. I see them after their procedure, get them enrolled or get them referred to cardiac rehab, and then once they come in, we do an orientation, which is a background information, getting to know this patient's medical history. We also do a 6-minute walk test, which we have them walk in the hall for 6 minutes just to see what they are capable doing exercise-wise. And from that, we develop an exercise prescription for the patients. So each patient has their own tailored exercise program. And this is something that we build upon each session.
So talk to me about, they have their doctor's order. You'd mentioned a 12-week program. What are some of the successes that you see from week 1 to that week 12 where they're graduating from the program?
Huge successes. I mean, cardiac rehab modifies every single modifiable risk factor for heart disease. So it helps them reduce their stress. It helps them reduce their weight, their cholesterol, their blood pressure. It gets them started in a safe, regular exercise routine and educates them about how to exercise properly. I mean, and like I said, I see these patients in the hospital. So the big success story is your open heart patients. You see beforehand, you see afterwards, and then they come in here, and the first session they're maybe able to do 10 minutes total of exercise, and by the time they walk out the doors, they're doing 50 minutes of total exercise, which is amazing.
Fairfield Medical Center then makes this facility available to them and their families afterwards. Is that correct?
That is correct, yes. Once the patient completes the program, they can continue to exercise here for just $20 a month. And at that time, we allow a spouse or a family member or someone to also exercise with them for just $20 a month. And so the facility is pretty accessible to the patients at all times.
Well, and looking at the facility, and I know that we've shot some footage that you've been able to see, it is a wonderful facility. It is of great value, obviously, to the patients, but it's nice that you're also involving their families and making it a success at home. So you're actually helping their environment at home as well.
Yes, yes. We've come a long way with our rehab facility. I mean, it used to be in a dark room, no windows, and now here we are in this lovely facility with lots of windows, which is uplifting for the patients. And yes, we do get their families involved. I mean, part of the rehab, of course, mainly is exercise, but we also do education. And we get the families involved with this process. We have education classes every Wednesday, and we invite the family to attend with the patients so they can learn what the patients need to be doing as well, so they can help them continue out these processes at home and help encourage this lifestyle at home as well.
Wonderful. Well, I would like to thank all of you for being with us today. And on behalf of the Interface Video team, I'm Susan Nixon Stoughton, thanking you for joining us at Fairfield today.